So what is functional medicine? Well, I guess the best way to describe it is it's addressing the root cause of a specific medical problem. So the mindset we actually carry is this. So if you think of, say, like blood pressure, well, if you've always been normal, say, from birth to 30, 40 years of age, and then all of a sudden your doctor is telling you, hey, your blood pressure is going up. Um, Instead of giving just having the primary doctor give you giving you blood pressure medications, functional medicine basically amounts to asking the question. So if your blood pressure's been normal for 30, 35 years, or whatever it might be, what changed? Okay, what caused your blood pressure to all of a sudden start climbing? And same holds true for high cholesterol, for diabetes, for thyroid problems, for all those types of things. I mean, what changed? And that's the question that most traditional physicians don't actually ask. They're actually thinking, okay, you have low thyroid. Okay, let me give you thyroid hormone. You have high blood pressure. Let me give you this blood pressure medicine. Um, Instead of actually trying to address what the sort of that quote unquote catchphrase root cause actually is, which is really what functional medicine actually is. It's the medicine that was actually practiced really prior to the 1900s, when we didn't have all the modern medical or pharmaceutical type of medications and things like that to try to treat certain symptoms. You really had to try to treat what was actually causing the initial problem. Now, that being said, our philosophy regarding functional medicine revolves around asking that question: what changed? So the way our functional medicine services work is this way. So typically we will give our clients a pretty in-depth packet to fill out. And this packet incorporates or goes over what their medications are. I mean, what kind of symptoms they actually have, how they sleep, what they eat, how they eat, do they have any, what their past medical history is, what their past psychological history is, have they ever had any traumas, have any surgeries, and so on. Much more extensive medical history. And then also, it'll also typically include any family history of things and things like that. Then what I do is typically we take a look at your existing blood work, okay? Because most people who come to us have already been to a primary care doctor. They've already drawn their blood counts, their blood chemistries, and things like that. So it gives me basically a starting point as far as where they actually are. And then from there, what I do is I sit down with you and I really start to explain what's wrong with you and why you may have this symptom or why you have that symptom, and then basically what causes it and what we're going to start to do about it. The objective at the end of the day is to actually try to address or to maximize or optimize your body's overall function or wellness so that your body actually works properly. Because the way I look at it is, and this is something that has become much more mainstream in a certain way, is that most people don't really understand that the human body is theoretically designed to last about 140 to 150 years. Yeah, we're breaking down at 40, 50, 60 years of age. And the problem with that is you've got to ask yourself the question, what's causing us to start failing, or our body starting to fail at such a young age? And the answer is your body's not working correctly. Okay, it's not working efficiently. And there are studies to the effect now that most people don't really realize that even at relatively young age, their body is probably functioning at only about a 50 or 60% efficiency level. Our goal is to increase that, to maximize how your body actually works, and to maximize not just your immune system, to maximize your blood pressure, maximize your heart function, and try to correct any issues that your body may actually be expressing from a symptomatic perspective. That is what functional medicine actually is. It's not a, hey, I'm a physician, you're my client, I give you this medication, let's treat this symptom. No, my objective is to work with you, because what I do with you, this is a collaborative agreement. I work with you to fix your medical problems, if or whenever possible. That is essentially functional medicine in a nutshell. Again, address the root cause.